This is the Coronavirus Morning Report for Friday, May 1st, 2020. I'm Brian McCullough. Crucial statistical crossover in Western European coronavirus numbers. Cosmetic surgery returns to Los Angeles. Cities are banning mask valves. What is the second week crash and what are the symptoms? Why the coronavirus is unlikely to disappear in the summer? And when will it be safe for kids to hug their grandparents again? If you follow the plethora of charts surrounding the coronavirus disease, a crucial event has occurred. A crossover in the charts, if you will. The number of new cases recorded in Western European countries has declined below the number of deaths reported in Western Europe. I.e., for the last week, the number of new cases in 7 Western European countries, excluding Great Britain, has been less than the number of deaths reported. This may be the strongest sign yet that the outbreak has been broken in that region. Remember that, logically, the death number is a lagging indicator. It takes a number of weeks between infection and death, and a number of days between confirmed cases and deaths. So one would hope and assume that the number of deaths in Western Europe will plummet in tandem in the coming weeks. More news about places opening up. While millions of Americans will be able to return to stores, restaurants, and movie theaters this weekend, stay-at-home restrictions are being extended in Ohio, Massachusetts, Minnesota, Arizona, and Washington State, among other places. South Africa implemented one of the most stringent lockdowns in the world after recording its first coronavirus death in March. You couldn't jog, you couldn't walk your dog. Parks were closed, and even the sale of alcohol and cigarettes was banned. Makes the luxuries afforded in the U.S. lockdown seem bountiful in comparison. Well, quoting the New York Times, beginning on Friday, miners will return to work underground, a crucial move for that country's economy in an industry already overwhelmed by high rates of HIV and tuberculosis infection. More than 13% of South Africa's population is HIV positive, meaning nearly 8 million people have compromised immune systems. Even with the eased restrictions, masks and social distancing will be mandatory, and an overnight curfew will be implemented. Most employees must still work from home, and gyms and restaurants will remain closed. Schools will not reopen until June 1st, end quote. South Africa, by the way, has only recorded 100 deaths and 5,300 confirmed cases of COVID-19. In case you hadn't heard, more and more airlines are announcing air crews will be required to wear masks, and American Airlines and Delta both said on Thursday that they will also require all passengers on their airlines to wear face coverings. Those two airlines have joined Lufthansa, Swiss Air, Australian Airlines, JetBlue, and Frontier in announcing that they would require masks on passengers during flights, which is one of those things that, in a post-COVID-19 world might become standard practice, maybe? I mean, how many times have you caught a cold after taking a plane trip? NASCAR becomes perhaps the first major U.S. sport to resume activities later this month, but it will do so without fans in the stands, quoting the Washington Post. A 400-mile Cup Series race on May 17th will mark one of the first major U.S. sporting events in more than 2 months after the coronavirus pandemic shut down racing and every other professional league in the country. So far, only UFC, Professional Mixed Martial Arts, said it will return sooner, on May 9th. The competition at South Carolina's Darlington Raceway will kick off a slate of 7 races across NASCAR's top 3 series, and all events will employ strict social distancing measures, the sanctioning body said. Below the empty grandstands, anyone present at the track will be required to wear a face mask, while garages and team motor coaches will be spread out to avoid possibility of spreading the virus, end quote. And I guess this is a very Los Angeles headline. Quoting again from the Post, nose jobs and facelifts will be allowed to resume in Beverly Hills, California, following a Wednesday city council vote that ended a 6-week moratorium on cosmetic surgeries. The amended ordinance allows medical clinics to resume all elective procedures, including colonoscopies and heart valve replacements, but it also permits doctors to perform surgeries that aren't quite so crucial. John Mirisch, the only member of the city council to vote against the change, argued that Beverly Hills should have drawn a distinction between medically necessary procedures like angioplasties and those that are purely cosmetic, like breast augmentation, end quote. Many cities and counties now require that you wear face coverings of some sort when on public transit or when maintaining appropriate levels of social distancing. But there's one kind of mask that you shouldn't be wearing, one with a valve in it. Quoting from Fast Company, "Some masks and respirators have a little plastic piece embedded in the fabric. It's a one-way valve. That means it closes when you breathe in, so pathogens can't get in through it. But when you breathe out, this valve opens up, creating a doorway for your exhalation to leave the mask. When you wear a mask with a valve, a significant portion of your exhalations are entirely unfiltered. A normal cotton mask is far from perfect at capturing virus particles that you might inhale or exhale. But when you add the valve, you aren't even filtering your breath with cotton. Your mouth is essentially an open exhaust," end quote. This, therefore, defeats much of the purpose of wearing a mask to begin with. You, possibly an asymptomatic coronavirus carrier, protecting others from the virus. Therefore, some areas, including the Bay Area, are banning masks with valves. But even if it's legal where you live, wearing a mask with a valve is still not recommended. Quoting again from Fast Company, "The reason we all need to wear masks is that we can all be infected with COVID-19 and not know it for weeks before showing symptoms, if at all. Doctors have also tracked occasions where people have tested positive, negative, then positive again. There is clearly a whole lot we don't know about COVID-19, but given that we're reaching the consensus that this pandemic can spread through the air, your mask should treat filtering as a two-way street," end quote. One of the most troubling aspects of COVID-19 is that the disease can suddenly get much worse in its second week. Known as the second week crash, it's where someone who seems to be stable or improving suddenly takes a turn for the worst. Clinicians don't know yet why this is the case, though one contributing factor is the happy hypoxic situation we discussed on yesterday's podcast, where the virus is causing a drop in oxygen levels that goes undetected by a coronavirus victim over a long period of time. Quoting from the Washington Post, "According to the Centers for Disease Control and Prevention, U.S. COVID-19 patients are currently hospitalized at a rate of 29.2 per 100,000 people. That represents about 10% of the 1 million known cases so far. Of those, only a small percentage require intensive care or ventilators, and only some will experience a rapid deterioration of their health. But people with the coronavirus can crash before or after they are hospitalized. Doctors report seeing patients who wait too long to seek care, including those who do not feel the symptoms of plummeting oxygen levels, such as shortness of breath, until they are in crisis. No one is sure why. Many people's lungs remain flexible for a while, allowing carbon dioxide out and forestalling the sensation that they aren't getting enough oxygen. The people who actually crash, they've actually been sick a while," said Mercedes Villanueva, an associate professor of medicine at the Yale School of Medicine. "They've underestimated how sick they are, or they've just waited," end quote. But it's not just COVID-19's attacks on the lungs that are the issue here. Quoting again from the Post, "Another line of thought focuses on the virus's possible effect on the cardiovascular system. Researchers have suggested that some crashes are caused by events such as heart attacks, strokes, and clots related to blood complications. Etan Raz, a neurointerventional radiologist at NYU Langone Health, says one theory is that some of the clotting complications may be caused by an overactive immune response that comes after the virus has settled in, multiplied and triggered by a defensive army of antibodies. An April 17th paper in the medical journal Lancet said that COVID-19 appears to have the ability to attack the lining of blood vessels anywhere in the body. Frank Ruzicka, a researcher from University Hospital Zurich, and his co-authors wrote that this may be why so many organs, including the lungs, kidneys, and intestines, are affected in patients with severe illness. It could also explain why people with cardiovascular disease, diabetes, and obesity, as well as smokers, are more likely to have severe illness," end quote. There is also the possibility that the use of ventilators, a last resort that nobody wants to end up on, contributes to an inflammatory response that can actually make things worse. As awareness grows of the problem, doctors are evolving their care protocols. As we discussed yesterday, some clinicians are putting their patients on blood thinners to head off clotting-related problems as early as possible. Others are placing patients on their stomachs to increase the amounts of oxygen getting into their lungs without medical ventilation. And if they do end up on a ventilator, doctors are monitoring the pressure closely to try to avoid overpressurizing the lungs and causing even more inflammation. All this gets back to why testing is so important. Those with no or relatively few symptoms need to be in a position where they are cognizant of their coronavirus status and more closely monitoring their health, for example, with the aid of a home pulse oximeter to check oxygen levels. I have another new Stamps.com convert in my own household. I told you how my mom now uses Stamps.com to send care packages to the grandkids, and now my wife, who has been sewing cloth masks to send to hospitals, but also to our family and friends, she's been using Stamps.com to print the postage needed to send those masks out to everyone. Anything you can do at the post office, you can do at Stamps.com, and yet you don't actually have to go outside and physically go to the post office. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send it. And you save money with Stamps.com, something that's especially welcome right now. 5 cents off every first-class stamp and up to 40% off USPS shipping rates. So you can stay indoors, stay safe, but still stay in touch with the people you care about with Stamps.com. And also you can save money. And you can save even more right now because listeners to this show get a special offer that includes a 4-week trial of Stamps.com plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage and type in briefing. That's Stamps.com. Enter briefing. Stay safe, my friends. Beachbody On Demand is the easy-to-use streaming service that gives you instant access to over 1,300 super effective workouts you can do right now in your home. And frankly, there's no better time than right now to start an easy, home-based, on your schedule, easy-to-do with no pricey extra equipment needed workout regime than right now when you're stuck in your home. There are hundreds of effective workouts for all fitness levels, ranging from bodybuilding to weight training to cardio hit to yoga, even dance workouts. Get motivated by celebrity super trainers you know, like Tony Horton, Joel Freeman, Jericho McMatthews, and Autumn Calabrese. You know Beachbody for things like P90X, Insanity, and 21 Day Fix. Now check out some of Beachbody's newest programs like Morning Meltdown 100 and 80-Day Obsession and start every day strong. Let's get in shape together, everybody. Listeners to this podcast can get a special free trial membership when you text briefing to 303030. You will get full access to the entire platform for free. Again, just text briefing, BRIEFING, to 303030. Ever since the pandemic kicked off, some people have been claiming it will simply go away when the weather gets warmer, because the seasonal flu only happens in colder months. This would be the same with coronavirus, right? Never mind the fact that the virus has spread around countries with warmer climates already. But a new, not yet peer-reviewed analysis from the Department of Homeland Security states that in agency lab tests, the coronavirus did actually die more quickly in sunnier, hotter, and more humid conditions. So does that mean the heat of the summer will destroy the coronavirus soon, in just a couple months? Scientists say we shouldn't hold our breath. Let's start with what this most recent study actually found, quoting BuzzFeed News. The experiment exposed virus in droplets of simulated saliva on a stainless steel surface to different levels of solar radiation to stimulate sunlight, as well as a range of temperatures and humidities. Under the 70 to 75 degree Fahrenheit temperature range with 20% humidity, the virus decayed by half over 18 hours. When humidity was increased to 80%, the virus decayed by half in only 6 hours. When the temperature was increased to 95 degrees Fahrenheit, combined with the higher humidity, the virus half-life again dropped to 1 hour, and the virus rapidly decayed in 2 minutes when exposed to 75 degrees Fahrenheit, 80% humidity, and intense solar radiation used to simulate sunlight. The virus similarly disappeared rapidly in aerosol foam, decaying by half in about 1 hour and 1.5 minutes, respectively, when exposed to 70 to 75 degrees Fahrenheit temperatures, 20% humidity, and no versus intense sunlight, end quote. A study conducted in Hong Kong and published in The Lancet earlier last month yielded similar results. But here are the caveats. First, David Relman, a professor of microbiology and immunology at Stanford University, tells BuzzFeed News that the behavior of the virus in the lab might not match how it behaves in the real world. nor do studies account for human behavior, such as how well people keep up with social distancing, washing hands, and wearing masks. Second, while temperature might actually be affecting the spread, even the hottest and most humid locations around the world have not been completely immune thus far. Remember how it's been summer in the southern countries already? Quoting BuzzFeed News, an MIT study that analyzed virus spread and so-called seasonality conditions across the globe found 90% of virus transmission recorded through March 22nd occurred within the temperature zone of 37 to 62 degrees Fahrenheit. Updated research on the topic, which has not yet been published, came to the same general conclusion that temperature and humidity are impacting transmission, Qasim Baraki, one of the study's authors, told BuzzFeed News. He noted that while low reported case numbers in certain places may be attributed to a lack of access to testing or a variation in social distancing measures, these things do not fully explain lower case numbers in hotter and more humid regions globally, end quote. Again, even if the virus does slow down its spread in the summer, it won't be eradicated completely simply by hotter weather. In fact, any slowdown might not even be measurable or noticeable. There are too many other factors, big ones being how the infection is spread, how many people have yet to be infected, and how little of the virus it takes to be infected. So yes, studies are showing that the virus decays more quickly in hotter, more humid environments, but that doesn't mean it'll go away this summer. To give you one more reason, especially since there have been a lot of helpful comparisons to the seasonal flu, here's a look back at the history of the influenza from a National Academy of Sciences report quoted by BuzzFeed. Quote, there have been 10 influenza pandemics in the past 250 plus years. 2 started in the Northern Hemisphere in winter, 3 in the spring, 2 in the summer, and 3 in the fall. All had a peak second wave approximately 6 months after the emergence of the virus in the human population, regardless of when the initial introduction occurred, end quote. Should children be able to hug their grandparents during the pandemic? And when might children be able to safely interact with their grandparents again? This is a debate that has opened up in Europe, where they are currently beginning to reopen society. And the question is whether kids under the age of 10 can now safely spend time with the older folks. Switzerland has revised its official guidelines to allow brief meetings between kids and grandparents because, according to Daniel Koch, head of the Swiss Infectious Diseases Unit, scientists, quote, now know young children don't transmit the virus, end quote. Dr. Koch said that only brief meetings are allowed in Switzerland, with babysitting still ruled out. He explained, quote, we are talking about brief contact with grandchildren, not get-togethers with the entire family, babysitting or spending time with the kids outside the home, end quote. He added, young children are not infected and do not transmit the virus. They don't have the receptors to catch the disease, and suggested that children's parents pose more of a risk to grandparents in terms of passing on COVID-19 than the kids themselves. The change was made after consulting with experts at universities in Zurich, Bern, and Geneva, according to the Swiss broadcaster SRF. However, it's not without its critics, even within Switzerland. Dr. Steve Reidecker, a Swiss physician and digital health expert, told Sky News, quote, people are a little confused because so far everyone said you're not supposed to approach your children. They have to be kept away from grandparents. And all of a sudden, the Infectious Diseases Unit is changing the rhetoric, and we don't know what kind of studies they are basing their assumptions on, and I assume it is assumptions. It's good news for kids, and it's good news for the grandparents, but we're not sure yet if this is a valid assumption, end quote. Germany's chief virologist Christian Dorsten told Austrian broadcaster ORF that there was insufficient data to conclusively say young children could not transmit the virus. Indeed, that's what we've heard from basically everywhere else as well. Advice elsewhere in Europe remains that social distancing must be maintained with grandparents due to seniors being more susceptible to COVID-19. And here in the U.S., the CDC advice is clear, quote, older adults and people who have serious underlying medical conditions are at highest risk for severe illness from COVID-19. Consider postponing visits or trips to see older family members and grandparents. Connect virtually or by writing letters and sending via mail, end quote. That's all for this week. Be sure to search your podcast app for Ride Home and subscribe to any of the great Ride Home podcasts in our network of daily news podcasts, including the Tech Meme Ride Home and the Gaming Ride Home. From Jackson, James, and myself, have a good weekend, everyone. Talk to you on Monday. Be well.